Now, convalescent plasma treatment involves taking the antibodies from the blood of a recovered patient and transferring them to a person who's infected. A little bit earlier, we spoke to the South African National Blood Services Senior Manager for Operations Testing, Marion Vermeulen.
Plasma has been around for many, many years, and it was used back in the Spanish flu, in fact, and again more recently with SARS-1 and MERS, which are also both coronaviruses. So convalescent plasma is actually the plasma that has been collected from somebody who has recovered from an illness. So for COVID-19, convalescent plasma is the plasma that's collected from somebody who has recently had COVID. They have developed antibodies while they've been ill to fight the virus. Those antibodies sit in the plasma component of the blood. We then take that from them in a donation and provide that plasma to a new patient who is currently ill. And the antibodies in the plasma are then there to help the patient fight the virus while they're still developing their own antibodies. So the hypothesis is that they will have a milder illness and that they will be discharged from hospital quicker.
Ah, all right. Fascinating. So when does this trial likely start?
So the trial is in two phases. So the first phase has already received Human Research Ethics Committee approval and has started. And that phase is the collection of the plasma. So the collecting, the testing, and the storing of the plasma. The second phase is the clinical trial, and that is still going through Human Research Ethics Committee, and it's being submitted to SAPRA this week for approval. Once approved, some training will be done in the hospitals, and then we'll start, hopefully early next month.
And how will you go about selecting the right people? I suppose with blood donations, even without COVID, there's a screening process as well there, isn't there?
Absolutely. So it's quite. So first of all, for convalescent plasma, the first thing is that the potential donor has to have had COVID-19 and have a positive RT-PCR test. Have recovered for at least 28 days since their last symptoms. Weigh at least a minimum of 55 kilograms and be between the ages of 18 and 65 and have never been pregnant before. So if you meet those criteria, then the normal blood donation criteria kick in, and that is to live a healthy lifestyle, had a risk-free lifestyle for the last 3 months, and also have good iron levels. But we will test those for you.
And
the difference...
Carry on.
So the difference with this product is because it's part of a clinical trial, you cannot just go to the donor center and go and say, I'd like to come and donate convalescent plasma. You need to register on our website as a potential donor, and a research nurse will then contact you to tell you about the trial, give you all the information so that you can then decide whether you want to be part of this trial or not. So it is slightly different to normal blood donation from that point of view.
All right. And how will you be able to map whether it's working or not?
So that's why we are only providing this in a randomized clinical trial. It hasn't been proven to work yet for COVID-19. So it worked for SARS-1 and it worked for MERS, and the only way to prove it is to issue it in a randomized clinical trial where you have one arm that receives the treatment, the convalescent plasma, and another arm that receives the placebo. And then you compare the two arms, the outcomes on the two arms, to see whether it has worked. Some statistical methods. So you would look to see, is the fatality rate lower? Is the discharge rate from hospital quicker? Time to getting better and being symptom-free quicker, and so forth, a number of outcomes.
All right. And how many people do you need to participate in this for it to kind of hold whether it works or not?
Our trial is going to be 600 participants. So 300 in the treatment arm and 300 in the placebo arm. There are a number of trials happening globally, and unfortunately in Europe, people are battling to find enough patients now to enroll because they're coming to the end of their pandemic, and so we haven't got that data yet, which is why I think we're really poised in this country to potentially be able to get the information to find out whether it works or not.
All right, okay. And you talked about MERS, and I just wonder, this kind of convalescent plasma treatment, it's worked on other diseases, other conditions before?
Yes. So it worked in the Spanish flu in 1918. It worked in SARS-1. It worked in MERS. It was used in Ebola as well, but in Ebola, it wasn't issued through a randomized clinical trial. So when you don't issue it in a trial setting, you don't know whether the person would have recovered without the treatment. So we can't tell whether it worked in Ebola or not. But it is one of the quickest ways when you're still trying to develop vaccines, monoclonal antibodies and all those kind of treatments. It's a very easy, quick way to provide passive immunity.
All right, we wish you the best of luck with the whole trial, and let's hope that it can yield some results quite quickly. But the other part of the work that you do is normal blood donation, and I spoke to, I think, your spokesperson a while ago, and there was a concern that people had stopped donating blood because they were scared to go, and lockdown also created problems for you. Is there still a concern in terms of the numbers of people coming forward to donate blood?
Yes, it's a big problem at the moment. It hasn't helped to have such a cold front as well. So our collections are down by about 25%, and there's still the need for blood. So we really do urge people who are blood donors, regular blood donors, to please come out and donate blood. We really do need it for the patients of South Africa.
All right.
So it has been quite difficult.
So under COVID-19, what precautions are you taking, and should they take? Can they just arrive at a centre, or do they need to make an appointment? How does it work now?
So we're advising that, if possible, to please make an appointment either on a website or through a call centre, or if you are a regular donor, you can also phone up your donor clinic yourself and make an appointment. However, we're not going to turn people away if they do come to the clinic. We've put a number of systems in place to try and reduce any kind of risk. All of our staff are screened daily as they enter the workplace. Temperatures are taken and they're screened for symptoms, and we wear full protective equipment. All donors coming will also be asked a questionnaire on past history with exposure to, or any exposure to, a COVID-19 positive person in the last 28 days. We also take their temperature, and we used to have travel questions as well, but that's obviously not happening at the moment. And then if they pass that and they come in to donate blood, we've got spaces between the beds so that there's social distancing, and the beds are decontaminated every morning and every evening, and then in between donors they're disinfected as well to reduce all risks. And then there's also obviously hand rub and those kind of things available for the donors as well.
All right, that's Marion Vermeulen speaking to us a little bit earlier on. She's with the South African National Blood Service. Interesting project that they're working on, convalescent blood. Let's see and hope that it does help in the treatment of people that are COVID-19 positive. And also, don't forget, you've got to donate blood very urgently.